BRCA1 and 2 testing is not something that every woman needs. Whether or not a woman should consider testing is really dependent on both her personal history of cancer as well as her family history of cancer. Most genetic counselors and most cancer genetics professionals, for a woman who's had no cancer, has no family history of cancer, would not recommend the testing, and it wouldn't be covered by insurance because the likelihood for that woman to carry a mutation is less than 0.25%. And a genetic counselor goes through detailed information about that person's medical and family history, reviewing pathology reports, determining what is the probability that there is a BRCA1 or 2 mutation in the family, and who in the family is the best person to test first. And that's an important point because this is a family affair, and if a woman has a strong family history, but she has not had cancer herself, she's really not the best person to test. There are several features that suggest that a family or an individual might be at risk for a BRCA1 or 2 mutation, and that includes cases of early onset breast cancer in the family, particularly if there are several, ovarian cancer in the same family as breast cancer, or even just 2 ovarian cancers in the family, a woman who's had cancer of both breasts, 2 separate cancers of both breasts, male breast cancer, and then any of those combined with Ashkenazi Jewish ancestry. Now, for the most part, just having one of those things is not meaning somebody carries a mutation, but it's the pattern going together. One thing that I really would like to emphasize, though, is that an individual who is worried about their family history of cancer or think they might be interested in BRCA1 and 2 testing, their first step is to see a cancer genetic specialist. Cancer genetic counselors in particular receive extensive training in genetics, cancer genetics, genetic testing, and also psychosocial counseling, because this is something that's pretty intense for a family.